You push the green light to speak. Bottom, yep.
Okay, okay.
Okay, okay.
Push that, it's on, okay? I guess we're gonna if we could get started, I'd like to call the meeting to order. And it's IT ready? Okay. Okay, and just so everyone knows that this is live streamed, and I'd like to call our meeting of the Delaware County Board of Health to order. At this time, we wanted to announce if there's any public comments on the current agenda. And I will check, would that go through John? The public- Okay. So at this time, I will recognize that there's no public comments. Our next action is the approval of the minutes from the previous meeting. And at this time, I will ask the Board of Health members who are here, I need a motion to approve the minutes.
Approve Lily Higgins.
Second, PJ Brown.
A motion and seconded. Any discussion on the approval of the minutes? Hearing none. The minutes are approved. Okay, and at this time, we also need to ratify the actions taken at our previous meeting. And this particularly includes the appointments of the chair, myself, Rosemary Hall, and our vice chair, Lily Higgins, and our secretary, Grace Scornflow.
Move to ratify.
Second?
Seconded. Any discussion? All in favor?
Aye.
Aye.
Okay, carried. And we also have to approve our bylaws as well, with one slight change in our bylaws from the previous meeting. Now also include in section 7, the inclusion of one or more members may participate in a meeting by means of conference, telephone, video conference, or similar communication equipment by means of which all persons participating in the meeting are able to hear each other. Participation in this manner shall constitute presence in the person at such meeting. So that is the only addition to our bylaws, and I will call for approval of the bylaws with a motion and a second.
Approve Lily Higgins.
Second from somebody?
Second.
Any discussion? All in favor?
Aye.
Our bylaws are approved. Next on our agenda is our board updates. And at this time, we will have Executive Director Howard Lazarus provide us with the updates on the Health Department project management. And this will be by a presentation. And although the screen's going down, we should be able to see it on the screens on the side.
Well, good evening, and thank you for the opportunity to come and talk about where we are in the process of helping to establish the Delaware County Health Department. We are at that point in a project that we can equate to being on a roller coaster. We're nearing the top of the first hill, and it is time to throw our hands up in the air and scream as we go through all the twists and turns. So any questions that you have, we can handle as we go through if you'd like, so we don't get too far lost in all the detail that's in the PowerPoint. So the presentation this evening is to provide an update on the work in progress and some of the upcoming requirements necessary for the successful launch of the Delaware County Health Department. Some of the supporting documents that I have sent or will send include the economic impact analysis that is currently in its final draft form. We will get the final copy and deliver that both to the Board of Health and the Council, and if desired, we can also have a presentation on it. We have the deployment schedule, which I have updated and will send to you. And then we have also sent the recruiting brochure for the Health Department Director. And that search is in full swing right now. We met with Scott Riley from Affion Public earlier in this week, and there's been a lot of interest from across the country in this position. Background, as you all know, Delaware County is the most populous county in the country that does not have its own health department. The Intercommunity Health Department does provide some related services, but it is really not recognized as a full-service health department. Primary goal of County Council has always been to establish the health department to better serve our community, promote wellness and equity and health outcomes for all the members of our community. The COVID-19 pandemic has certainly identified the shortfalls of the county's current approach to providing health resources, and the Delaware County Health Department is scheduled for full launch on the first of the year of 2022. Funding for the second half of the county's fiscal year is included in the state budget that was adopted of about $1 million. The disappointment was that the state did not increase the total amount of funding. So by us being introduced as a health department, others will most likely see their funding reduced. The $1 million is for 6 months because the state is on a July through June fiscal year. So we would always be able to assume that we'd continue to have funding in subsequent years. I'm going to talk a little bit about the launch sequence. On the left-hand side, you can see the main project task areas and the elements of the county government that will be included. And on the right, kind of the mission control shows that there is an overlap between the Board of Health and County Council. Certainly the operations of the Health Department fall underneath the Board of Health, but Council does have the responsibility to set budget, to assist us in hiring staff, and to provide oversight of all county operations. So that overlap, I'm sure, will be smooth, it'll be cohesive, and it will help us get through the tasks that we need to do in order to launch the first of the year. So I'm going to go through each one of those areas separately. If you have any questions, I think it's good to stop along the way rather than to wait till the end. So the first is to provide project management, and that work is in progress. I think you've met Sabine Rodriguez, who is really the day-to-day project manager that we've engaged. She's most excellent. Next steps are to hire a health director, so the health director can not only manage, but also be actively engaged in forming the procedures, the locations, the budget, the hiring for the health department. And as I get into this, my discussion really here is about people, places, and dollars. And that's what I've been focused on. We do need to develop the full-time project team right now. And we actually have to transition from a vaccine focus to a health department startup focus. That's not to say we still don't have challenges ahead with the variants of COVID, that we still don't have to pay attention to encouraging all members of our community to get vaccinated. But there are many, many more resources available now than we had last year at this time. And vaccines are available from a variety of sources other than the county. So the folks who have been involved actively in the vaccine program need to really start to transition to look at health department issues, because as we get down that roller coaster, there are going to be an awful lot of twists and turns that we're going to come across that we'll have to deal with. The economic impact analysis, as I mentioned before, has gone through an extensive review that's completed. We're finalizing the document. The document really has two parts. One is establishing the resources and looking at what we need to set the health department up. And the other is looking at the extended economic impact on the community. So both of those have been reviewed. I said I hope to accept the report shortly, and then we'll schedule the presentations to both the Board of Health and County Council. We'll have to start the transition actions and activities with our municipalities. That's in progress. We are meeting with all the municipalities. That will continue through September. There are issues that will come up. There is everything from the municipalities who have their own health departments and are very proud of them, to how do we help provide sort of a financial ramp to the transition. So those are things that we need to discuss. We'll address them with each entity as we go through them. We have to look at the different codes that exist and come up with something that is consistent and consolidated. Uh, Proposal to gain state approval of the health department is in progress. I'm going to rely on Grace to talk about that if you have any questions, but we do need to complete any supporting tasks. The contractual support, we have issued requests for qualifications and proposals, both for a firm to help us with interim staffing and hiring, and for architectural engineering services. Those are out. They're due back July 15th. I hope to have them before council not later than the first meeting in August. So that work is ongoing. And then we do need to hire and engage the launch team. And I'll show you what that looks like on the following slide. So on the project management side, I mentioned before, we need to hire the health director. We're really more looking towards September, but I am looking to encourage Affion to move a little bit quicker. But it is always going to be important that we get the right person instead of the person right now. I mentioned Ms. Rodriguez. On the technical leads, we need to hire the bureau chiefs to develop and lead all the technical areas, all the practices that need to be put in place. Once we get the agreement and for the support, HR support for interim staffing and hiring, I think we'll be able to do that towards end of July, beginning of August. On the procurement side, we do need to hire a buyer that will be part of the health department to support the effort and to assume a permanent role. We do have a lot of supplies and equipment to specify and purchase. On the personnel side, we're looking at a staff of 1 to 2 people in personnel to support the recruitment, but then also to be there over the long term. Facilities, I talked about the AE contract for facilities plan, but on next week's council agenda, we do have an agreement with Lynn Architects for phase 2 of the Yaden build out. And excited about getting started on that sooner rather than later. We probably also need to look at the services of a real estate attorney because part of developing the facilities plan may involve renting or purchasing property. On the finance side, we do need a grant manager and a budget analyst for the department, and we can bring them on sooner rather than later so that they can be engaged in developing the 2022 budget as well as managing the interim 2021 budget. On the IT side, Mr. Bellata has identified a dedicated IT staff member who is most exceptional. We're looking to hire the public relations staff member. And then finally, I spoke briefly to Mr. Martin, the county solicitor, about engaging a solicitor for the Board of Health. And probably need to do that sooner rather than later as well. On the governance side, there are some relevant charter and code sections that we need to look at, and we should try and stay away from modifying the county charter because that requires a vote of the public, where council can modify the county administrative code. I believe we can use the intercommunity health, which is both a charter requirement and a code requirement, and we can use them, modify their scope of work, I think, and go along with that. Also from a budgeting standpoint, just some background on the charter and the administrative code and some things I had just mentioned. County charter does create the intercommunity health department and the intercommunity health director position. Those report to the executive director. That language will have to be changed to incorporate the Board of Health, as well as change the title. So that'll go through all the sections that are shown there. The other thing that's interesting is a section of the code, 6-94, establishes the functions, duties, and organization of human resources, which we call human services, which is interestingly why we call human resources personnel. But we should look and see what is in human services that has overlap with the health department. That could include areas in behavioral health, mental health, and drug and alcohol treatment. So those are some of the things from a governance standpoint a solicitor will help us evaluate. Facilities and logistics, my favorite. Phase 1 of Yaden has been completed. We did that as part of our vaccine preparation. There are some warts that we need to address. We need to look at the HVAC system. We need to look at modifying the lease a little to allow for us to put some extensions in there. As I said before, we are going to present the contract to council for approval to build out phase two. I'll get the chief financial officer to work with us on funding, and then we should be ready to go to build that out really pretty quickly. Mr. Lin was the architect involved in phase one. He has intimate knowledge of that building, all the good things and all the things that maybe need a little bit of work. We have to look at other locations, developing a facility and location plan, maybe leasing, maybe purchasing, maybe repurposing some facilities that we have. And then finally, on equipment needs, we're going to have to develop the procurement requirements. We'll coordinate with central purchasing and fleet. We probably need to buy some vehicles for the inspection team. And then again, work with the CFO to find the best source of funding. The funding does exist. We need to work out on what's most appropriate. It could be from some of the coronavirus relief funds that we have. It could be capital funding from the county's capital accounts, or it could be from the general fund. Funding is there. We just need to make sure we use the appropriate source. On technology and communications, we do have a dedicated staff member. We need to really look at what the software is that will be required, what the systems and requirements are, and how we can best support that. That actually really has not started other than identifying the staff member. Personnel, I talked before about hiring the health department director. The contract to support hiring staff, I also mentioned, is due back on the 15th of July. We need to identify that staff that already exists in the county that will migrate into the health department. Some of the initially identified staff have been contacted. Some are in emergency services. The intercommunity health staff are also ones that we would look to migrate into the Delaware County Health Department. And then we really need to put the pedal to the metal and start to recruit and hire phase one personnel. We are developing the position descriptions, and we need to present the required staff to the council's personnel board. That's currently on the agenda for next week as well. It's a little bit atypical of how we do things because we're going to ask to get the authority to go out and start to search before we actually have fully defined the positions. We do have a general salary range, but we need to validate that as well. Those are things in the personnel area, which will be the most critical, I think, as we go over the coming months to get the right people in place, things we need to do. The phase one staffing, I guess later on the agenda, you'll approve the organization chart. And when you add up the number of bodies, there's 67 and a half full-time equivalents on that org chart. We've done market comparisons, so we do have a feel for what those positions should be paid. And some of the other things on there I have talked about before. When we had the work session, the Board of Health members talked about what roles they would like to review and approve. So that's something you'll need to work with both the interim and then the permanent health director. Good case in point was the epidemiologist, the medical advisor, and some of the other positions. And the last bullet on there, providing workspaces, is going to be also a scheduled critical activity. Finance and budget. Done a preliminary estimate. I will review that with council and then bring it back to the Board of Health. Council approval for the different sources and uses of funds will be required as well. On the capital side, the architect engineer services will help us with the facility plan, and we'll be able to then go forward and try and figure out what the appropriate funding source is for those capital improvements. The last bullet on the right is we do need to validate vehicle requirements, what we need to purchase, and certainly either hybrid or electric vehicles are what I would look for us to purchase, consistent with the county's sustainability goals. So those are things that we'll also look at doing over the next 6 months. And in summary, the work's in progress, but we do need to form the project team under the health director. The phase two build out architectural contract is on the agenda for 7/7. Contracts for interim staffing, recruiting. If I can get them in soon, we'll get them on the 7/21 agenda. It's probably more looking like the first of August, first meeting in August. We need to finalize the startup first year and stabilized year budgets. We do, as I said before, there is $1 million included for the health department in the state budget for their current fiscal year. The team needs to develop health code, inspection codes, fee structures, policies and procedures, and address the governance structure. And finally, the facilities plan is needed for countywide delivery of services. So I hope that update has been helpful and informative and open to any kind of questions or discussion that you may like to have.
Thank you, Howard. That was really informative and quite the to-do list that we have to go, but I know we're well on our way of getting it done, so thank you. Does anyone have any questions for Howard? I know we did discuss this during our work session, and, I think we all felt comfortable with the plan that you have laid out. So thank you.
Thank you again, and thank you
Oh,
for
did
your
you have
service. Yes, sir.
Howard, is it the expectation that in the hiring of the health director that person will relocate immediately? I mean, since it's a national search, there's a chance.
That's a great question, and it really does depend on the individual. I think it's reasonable for us to assume someone will want at least a couple of weeks to find a temporary place to live. And part of the stresses that person will feel will be finding a permanent place to live while he or she is trying to start up the health department. So it's not really a direct answer. It really depends on who the person is and where she or he is coming from.
I ask because the timeline is tight.
It very much is. And that's Councilmember Vice Chair Taylor impressed upon me the need to talk to Affion about accelerating the process.
Good to have them here yesterday.
Yes.
I don't disagree with you. I think we would still had to have the Board of Health in place before the hiring was.
Yeah.
The big delay in there in talking to Scott is they'll close out the formal receipt of resumes during July, and then they have to chase down people. They have to do their preliminary screening so they can come back to you with a binder of probably 6 to 8 candidates that you'll look at. You may want to do some Zoom interviews and then get down to a handful that we'll bring in for face-to-face interviews. And that's probably early September by the time we get to that. And to your point, you make the offer is probably first, second week in October before the person's able to really be here and be effective. That is late in the game.
Other questions?
Well, thank you again.
Thank you.
Appreciate the opportunity to work with you on this. It's one of the most significant things that we'll all get to do during our public service careers. So appreciate your diligence and guidance on it.
So much, Howard. At this time, we were going to have a progress on the Act 315 application by Grace Cornwell. I think you can do it from there. Does she? Are you doing it? It's not electronic. Oh, okay. Yep. Oh, you know better than I.
Okay. I don't have slides for the first. I have slides, not quite yet. I was going to start with Act 315 application and give an update on that. So the Act 315 application, just to remind everybody, is we're planning to submit this in November. And we are working hand in glove with the state health department to make sure that we have precisely what we need when the application is submitted. They have approved an outline in terms of the the information that we need to include in the application. And we are just now starting to draft it. So we're going to be drafting it program by program over the next several months, and we'll keep you updated on that progress. Now, a really important part of developing the proposal is holding the series of think tanks that we're in the midst of. And the purpose of the think tanks is to get input from the community about each of the program areas, as well as a couple of foundational parts and foundations of the health department. So to date, we've had think tanks on health equity, immigrant health, maternal and child health, communicable disease, and chronic disease. And we have, when we did our listening tour, we let people know how to sign up for think tanks. We also have an email that we've sent out to interested individuals, letting them know about the think tanks. We've also reached out specifically to various groups, depending on the topic, to encourage people to attend the different think tanks. And we're continuing to do that for each of the different subject areas. To date, we've had about 5 to 25 people, quite a range, depending on the topic. And what I can tell you is, even though one way to gauge how successful the think tank is, of course, is to think about the number of participants. What I would say, however, oh, this shouldn't be showing. I'm sorry. I didn't realize. Sorry about that. I would say, though, that that's not the best way to gauge success. I think all of our think tanks have been incredibly successful because people have been so incredibly engaged. Even when we've had just 5 people who have joined us, the conversation has been very, very meaty. And we've walked away with some really, really good information. So what I wanted to do very briefly is just let you know about the themes that we've been hearing from sorry. Thank you. Sorry about that. So with all of the think tanks that we've held so far, there are some themes that have risen to the top. And they are, first and foremost, the importance of cultural competence and racial justice being at the heart of activities, and absolutely being the foundation for how we think about all of the services that are provided. The importance of getting out into the community and developing trust. And this is true for everybody, and it's really come to light the importance of this with respect to immigrant communities, as well as students, not only teenagers, but also students in university and college settings. We also need to really concentrate on connecting people to services. A lot of services are out there, and of course, the job of the health department is not going to be to duplicate anything, and there is a really important role in terms of case management in some cases, as well as referrals in others. We've also been encouraged to think a lot about social media, and also anytime we bring in a grant, to think about sustainability. And when we bring in a grant, make sure that we set goals and that we keep our eye on the goals, and that we only take in a grant if we feel that we really can sustain something over a period of time. So I would say that those are absolutely the themes that have been prevalent throughout each of the topics. We have three more topics scheduled. Starting next week, we will do violence prevention and injury prevention, and that will be followed by environmental health, not the inspected, not anything that's regulated or inspected, but other aspects, environmental health. And then in August, we have access to care. There are other topics that we will also cover, and those will be scheduled starting in the fall. And all of this is on the website, just so people are aware that they can also access the information on the website. So any questions about the application or the think tanks? So now I will
Thank
go.
you, Grace, for that update on the think tanks. Just as a reminder, too, if there is any way that we can send out additional information to really encourage more people to participate in the think tanks. Great opportunity for all of us to participate.
Say that I didn't hear you. I'm
I was
sorry.
just saying that it would be really great if we had, it maybe just to make sure that we all have the information to maybe send out to the interested groups going forward. I know you sent us the dates and the things, but if there was like an invite that we could send people, that would be awesome too.
Okay.
Deborah.
And I thought we were doing that.
So if there was like, what I heard feedback from people was saying if there was a flyer that they could share or some
I
kind
see what
of
you're saying. So another, like,
another way to invite people
Gotcha.
to give them
Thank
some
you.
background information for the specific
okay,
think tank versus
Perfect.
just like, this is the dates and the times.
gotcha.
Maybe.
Sorry, I'm
Yeah.
slowing the uptake
No,
here.
it was my fault. I wasn't clear on explaining what people
That's a
had,
great
the
idea.
feedback that I
Can-
had heard.
Great, thank you.
I have a
Absolutely do
question.
that.
How are the residents, Delaware County residents, informed about the think tanks?
So a few different ways. Well, at this point, we have an email. We've been encouraging people to sign up for email updates. We've been doing that through our listening tour. And we have a list of about 100 people, I guess, as well as we've got another host of different organizations that we have communicated with. And so between those two different lists, if you will, that's how we've been reaching out and inviting people to the think tanks yeah, I guess that would be the answer.
'Cause I'm wondering if we're capturing like enough data from a wide range of people, because maybe the people that are responding or participating are not, they might be from a certain demographic because they're connected in some way, but I'm wondering if we're getting, enough information from all of the different segments of the county. Yeah.
So I think that's a really good point. I know that internal conversations, something to share about our internal conversations is that the think tanks are not necessarily a one and done. They are a one to get us started on this. And what we're learning, one of the questions that we ask about is who else we should be partnering with. And so there are two things going, well, and as I said, we've been hearing loud and clear the importance of connecting with community members, which is one of the principles. If you look at the vision, mission, and value statement for the health department, that's embedded in there as well. So as we move through, there's going to be, regardless of what we write into the proposals, a very important part of the health department's work is going to be out in the community and developing these relationships and making sure that the programs as they're launched really are driven by community members, that we've listened to the community members to understand strategies and so forth. So it doesn't mean that we can't do more outreach now for future think tanks. We certainly can, and we will. And it's just the first step or two to really reaching out. Does that make sense?
Yes. Thank you.
Yeah, sure.
Grace, you're also giving us an update on the environmental health inspection transitions.
Yes. And so this is what I have slides for. Oh, yeah. Okay. All right. So transitioning environmental health inspections. As you all know, this really is a highly significant issue for the municipalities throughout the county because most of the 49 municipalities right now perform all of the inspections that are required, that are health related, that are required. And once we become an Act 315 county health department, we are required to provide all of those inspections. So this is going to be a very big change for municipalities. They've been doing this for years. They've got staff or contractors who've been working with them for years to do this. Those inspectors have relationships with vendors. The municipalities have relationships with their residents for permits that are needed and those kinds of things. So this is going to be a big change, not only for the municipal governments, but also for the people who are being served. And so we are working diligently to, acknowledging all of that. We're working diligently to make this transition as smooth and efficient and as we possibly can. So just wanted to give you an update on where we are with that and how we're going about this. So what you see on the screen are inspected entities as required by Act 315. So these are the different entities that have state requirements in terms of the types of things that need to be inspected on a regular basis. And the regulations for these come out of the State Department of Health, the Department of Environmental Protection, as well as the Department of Agriculture. Excuse me. So our guiding principles in terms of how we're going about the transition are up on the screen now. The first is to include the municipal leaders every step of the way and to make sure that we're being very communicative and that there's really good two-way communication. The next principle has to do with developing the county inspection codes. The state agencies that I just mentioned have their own requirements for codes, and municipalities can also add to those requirements, and many of them have. And so there are different codes for different municipalities. So when we go out, then when we assume the inspection responsibilities, we will have one county-wide code. And the way we are going to do this is to review all of the municipal codes that go beyond what it is that the different state agencies require. We're going to be talking with the municipal leaders to understand the benefits of things that vary from what the states require, and then have a discussion with them as we're pulling together what seems to be the best for countywide and make sure that this is done in discussion with all the municipal officials. So that's another, the most important thing I think here to understand is we really do want to understand why the variances exist. And we're not just going to make unilateral decisions. We'll make sure that we've had discussions. And then finally, the fee schedule. So the inspections are a net neutral program, and the fee schedule will depend on the code itself, because that ties into the level of effort that's required for staff members when they go out and do the inspections, as well as the number of inspected entities throughout the entire county. So we'll need to have all of that information together before we'll know what we need to charge in terms of inspection fees. So some of the activities to date, the key activities to date, first has been a series of meetings that we're holding with the consortium of governments. This is a really nice venue to address the municipal leaders as a group. We've had 3 meetings to date. Another meeting in September, and at that point, we'll also talk about how many more meetings or what a good frequency of meetings with that group will be. The other thing that we're doing is holding one-to-one meetings with each municipality, because every municipality, as you all know, is different. And so we really want to make sure that we understand from each municipality what is unique about them, as well as I was talking about the variants in codes. So actually things have changed when we talk about what's happened to date. 5 meetings have been held to date. However, last week, 11 additional meetings had been scheduled. That's up to about 20 now. So we're still reaching out and trying to make sure that we have an opportunity to meet with each municipality by about mid-August. So those are the activities that we are engaged in. And as we're getting information and things are evolving, we're also modifying our approach a little bit. And I'll talk about that in just a moment. So these are the key transition issues. The one, again, is understanding the unique impact on each municipality. And of course, the impact will vary according to a number of different things, the types and numbers of inspected entities that they have, number of staff they have, and again, their code. Also, another issue is communications. One thing for us to work on is communicating with residents, because it's going to be really important for residents to understand that when they need to contact the county instead of contacting the municipality as they've done in the past. We really want to avoid frustration and confusion around that to the degree possible. So that's one aspect of communications. The other, it has to do with the business owners. And that also gets into the notion of a warm handoff between with inspectors and the owners. So we really need to make sure that business owners are very well aware of the change, that we work with the municipalities to understand and to conduct a warm handoff with them. And that also, and we also need to, within communicating with the business owners, have some two-way communication, again, about the change and about what will work best with them. So we don't have a strategy for that yet, but that's something that we'll be looking to. And then finally, once the county has assumed inspection responsibilities, we also will need to make sure that we're communicating back to the municipalities regarding inspection results or any issues that are found in a way that meets their needs for information. So that will be something else that we're working on. So that is everything that I had to tell you about the transition.
Grace, the only thing, I think this is great, and I think it's a great communication plan, particularly. But my only comment, and I think it's something that we would like to work on maybe a little bit, is you mentioned bringing the businesses and communicating with them, but I think that talking to them along with the municipalities or having separate meetings right now, updating them would be really helpful. Because I think there's a lot of positives about this transition that they're unaware of. For example, that this will be now a uniform fee schedule, that this will be, won't have to go, if you're doing a building project that, crosses township lines, that you're not going to have to get 3 different permits. And so that there's a lot of things that people have misunderstandings about. And I think having a meeting with them to also address their questions or concerns different from what the municipalities may be telling us as well.
I think that that's a really, really good point, because there are a lot of benefits. And so they are part of the change. So it's important, I think, for them, I agree with you completely, to understand the benefits and also to help us understand how we can make the change as smooth as possible. Yeah, thank you.
Do you have any questions or comments?
Grace, who will do the review of the municipal codes? Will you be doing the review, or you said
So we
the-
have a few people who are working on this. We have a wonderful intern who is helping out with getting this information. Lori Devlin, the director of the Office of Intercommunity Health, she is also involved in that, and then I'll be involved with it as well.
and something you said made me think that there may still be circumstances in which residents or business owners would call the local municipality.
So they could, if they don't understand that what the county is doing now in lieu of the municipalities having those responsibilities. So for example, if you're a new business owner, you're opening a retail food establishment and you need your initial permit, as an example, then you would need to know to call the county and not to call the municipality for that.
Are there any responsibilities that will be retained by the municipalities? Are there any responsibilities that will be retained by the municipalities?
Not for health-related inspections. There are other things that they inspect. They have inspectors for other purposes. But when it comes to the health-related inspections, the 3 state agencies that I mentioned, well, the state health department requires county health departments to conduct those inspections that I showed on that first slide. So those are all the things that we need to do.
Thank you.
I think you said at one of the meetings, Grace, that one of the examples of that is, for example, a lot of the municipalities do their fire code inspections at the same time that they may be doing health, and we wouldn't be doing the fire codes. Is that correct?
Well, I think that's a really good, that's an excellent example, and that's something that we are not required to do at all. And then that's something we'll have to discuss with them. That is sort of embedded in their code or in their processes. So that's a good example of something that we'll have to, we're not required to do it. Let's just leave it at that. We're not required to do that.
Well, thanks again, Grace. That was really informative. And I just had a question, Grace. Are you putting up the org chart or are we just approving?
Oh, I can. I just like to unplug this too quickly.
So I'll just mention that it's okay, Grace, because I think we all have a copy of it. Okay. So at this time, this will be under our new business, and we will be approving the Health Department organizational chart. All of the board members have been given a copy prior to the meeting and opportunity to ask questions specific to it. So we will not, have a large discussion at this time about it unless anybody has any additional questions. But Grace is showing it on the screen. And there is 2 phases to our org chart. So this is the first phase. And then phase 2 is the expansion of the health department as we grow into and meeting additional requirements, not only for Act 315, but as we move into the possible accreditation. So at this time, I will ask if I have a motion to approve our organizational chart. Thank you very much. Any discussion now on, or any questions about the organizational chart? As I mentioned, we all have seen it and have made questions and comments before. So at this time, I will call, and all in favor of approval of the organizational chart?
Aye.
So our organizational chart has been approved by the Board of Health. One more step. Thank you so much.
Sure.
So at this time, we are going to move into just reminding everyone that our Board of Health meeting schedule can be found on our webpage. We will be having monthly meetings, public meetings, through December 2021. We only have a requirement for quarterly meetings, but due to the nature of forming the health department, we felt that it was necessary to meet at this time monthly. And we will be announced, our next meeting is August the 5th. In between these meetings, because of we are possibly looking at reviewing the county health department director applications and processes, we will be having some work sessions in between the public meetings. At this time, we have no public comments since, yep. And so I will call for a motion for adjournment. We're on approval that we are adjourning for the evening. Thank you so much and have a good day. Okay, thanks.